Hi, hello again. This is Dr. Pam. How are you doing? We're talking about COVID-19 and, the things that are happening. Recently, we saw, how the progress with COVID-19, but I'm just going to give my perspective. This is information. I am not treating anybody. You can't use this information to say that I gave you this information to treat yourself. You have to see your doctor. You have to see a specialist to be treated if you have COVID-19. But what is happening? What are the things that are happening right now in 2020, July 2020? What is happening around the world? COVID-19 is still there. People are still dying. Millions and millions of people have died. Some have been, have been infected and have been treated, have got home well. We thank God and we pray for those families that have been affected by COVID-19. That said, where are we right now? Where we are right now, we don't have a cure. Where we are right now, we are treating symptoms. And now, according to the CDC, the symptoms have been, people have come up and, given their testimony about the symptoms, the after effects. And according to the CDC, we have around 10 symptoms. And people come with different symptoms. Some people are asymptomatic. They don't even know they have COVID-19. They get it, their body works magic and they don't, show any symptoms. And some people have 2 symptoms, some have 3, some have 4, some have the whole 9 yard. So everybody's body behaves differently. Some of the symptoms that have been reported according to the CDC is fever and chills, cough, fatigue, muscle or body aches, headache, loss of taste, sore throat, congestion and runny nose, nausea, vomiting, and diarrhea. Those are some of them. And some people have said different symptoms that have not been written on CDC, so we are going according to the CDC. But according to the CDC, how are we treating in COVID-19? They are using different mechanisms to treat COVID-19. They are treating the symptoms, mostly those who are affected by the pneumonia or who are affected by chest pain or the lungs are affected. They are using a combination of antibiotics. They are using a combination, mostly the antibiotic that everybody or even some of my patients who have gone to the hospital or what we have given some of our patients is a combination of antibiotics and also we have given them other medications that will help boost the immune system, encouraging them to keep breathing, doing things that are going to promote their well-being. One of the medication, as I said, it is an antibiotic, azithromycin, which mostly people know it as a Z-Pak, has been used with a combination of other medication, and that is what some people go home with zinc, with the antibiotic, azithromycin antibiotic, and they go home and take medication and they feel well. Some people who are very ill, they have been treated by other medications in the hospital that are combined with antibiotics. Even if it is a virus, they are using antibiotics to help patient get well. Some they are given nebulizer treatment, albuterol, so that it can open their lungs. So doctors use different combinations. Somebody was talking about yesterday, a lady was talking about, Dr. Stella Emanuel was talking about hydroxychloroquine, and it has not been approved by FDA, but she and her team have been using with a combination of antibiotics. And the reason why they are using this medication, there was a study that was done in France and even in China, they were using hydroxychloroquine. But the lady did not give us an explanation why. The viruses are very, very difficult to treat. And the reason why they use this hydroxychloroquine is because it is an anti-malaria, but it's because of the zinc that it has inside it, that it has to go, because viruses are very small, and in order to treat a virus, you have to go inside to the core of the cell so that you can kill it. So what scientists are using hydrochloroquine is because it goes inside it penetrates inside the cell so that it can kill the virus, so that it cannot replicate itself. This medication has not been approved, but some doctors have used it. For me, my take on this medication is this: why can't we continue doing research and see if it actually is being used, and it is a combination of this medication and other medication, is it helping? Because Africans have to wake up and know, if you have this medication and it is helping, and you have to weigh the complication that comes with the medication, or if you are going to leave these people to die. If the complication, people can live and survive with the complication, then you know what? Do research about it and see if a combination of antibiotic like azithromycin with hydrochloroquine or ridenavir, which also has been talked about, if the combination, the scientists, African scientists, you can't wait for Americans to come and treat you. You have to do this yourself. As Africans have to do it for us. So scientists have to be busy, and people have to be willing to be used. If the complications are not severe, people have to be willing to be used as subjects so that we can know if these medications are working. Because way too many people are dying, and way too many people are losing their loved ones. If we can find a cure for this, we will be so happy. So my take on this is that we need to continue doing research. We need to continue using what has worked, and we need to continue wearing masks. We need to continue keeping social distancing. We need to continue washing our hands and doing those things that are going to make us prevent the spread of the disease, and doing things that are going to make us prevent infecting others. Washing hands, wearing masks, social distancing, going to CDC and seeing what is the latest. Because World Health Organization, CDC, these big bodies that are having people, doctors working around the clock to make sure that they find a cure, they find a vaccination. But as you know, that viruses take time. Very few viruses have been eradicated. So it takes time. We need all of us to work together and help each other. Thank you. Be blessed.